This is a quick demo to show you how to record a dictation with the CascadeMD mobile app on a PointClickCare connected facility. So the first thing you'll want to do is download the mobile app. This can be from the iOS or Android store. And once installed, you'll log in with your CascadeMD credentials. Now, when you do first log in, you may have to authenticate with your PointClickCare credentials as well. That would be a screen that looks like this. If I do select OK here, it is going to just ask me for my PointClickCare credentials, which then authorizes me. And the purpose for that is obviously we need to make sure that you're seeing the correct patients, and it also allows CascadeMD to create the progress note inside of PointClickCare based on your dictation. So to begin my dictation here, I'm going to select my patient list, which in my case is all patients. And then I can search or select the patient for which I'm going to record a dictation. Now, from here, we have a few options and a few pieces of information we can look at. The general screen is diagnosis, but we have some other information that we pull from PointClickCare across the top. Now, when we set up your account, we do create some triggers, things like insert vitals, so that while you're dictating, the vitals can get pulled in, or insert diagnosis. And you do some of those configuration pieces just before you record the dictation here. So up at the top, I can see vitals. This one I don't have to do much with. This is also just so I can see it. But when I get to diagnosis, we'll see all of them that exist for this patient. And of course, not all of them may be relevant to what I'm doing, and that's why there's checkboxes here. So I can check off the ones that are relevant. And now when I say insert diagnosis versus while I'm dictating, it knows just to pull those ones in. Same with the labs. I can see any labs or panels here. This is a lipid panel. Again, I can check it off as maybe something I want included when I say insert labs. Same with medications. I can expand this out and I can see information on the medication. And I can even see past progress notes as well. I can expand this and see any past progress notes. Now, to begin recording my dictation, the first thing I'll want to do here is select the work type. And this is the progress note type as it is in PointClickCare. So I can scroll through, and in my case, I'm going to say this is a narrative note. And then I can select a template. And when we set up a CascadeMD account for your facility, we will create templates. It might be an H&P, it might be just a standard SOAP note, or as many as you want. And this is just basically telling CascadeMD what type of note you're doing and what it should be listening for. So in my case, when I select default progress note here, it knows to listen for subjective, objective, labs, assessment, and plan. In my case here, I'm going to start dictation. And I'm actually going to do a quick dictation here. So we do voice to text in real time, so you'll see that flash across the screen here as I quickly record this, which I can begin by clicking Start Recording. Subjective. Patient seen and examined. No events reported overnight. Objective. Insert vital signs. Labs. Insert lab. Assessment. Insert med diagnosis. So once I'm done there, I can click the stop button. And what we're seeing at the top is just exactly what we had said. So just showing me kind of that running list of exactly word for word what I said. It hasn't performed any of the conversions yet, so I'm not seeing the real vitals. That happens when I click next down at the bottom. I can listen back to it, but really when I click upload is when we do the conversion on these things. So I'll click upload. And this will just take a second or two. And what we'll see here is our note. So we can see that now it's gone and it's grabbed the information. So under objective, I had asked it to insert vitals, which it's done. Labs, I had asked it to insert lab. Now I can edit any of these sections right from the phone here if I needed to add or adjust any information just by clicking this pencil. But once I'm done, if everything is good here, I can actually just click submit. And when I do that, this has now been sent to PointClickCare, and the progress note has been created at this point. That's about it as far as recording a dictation goes. If you have any questions, please let us know.